Meanwhile, we continued to grow the movement, to have obviously a lot of people work in the secretariat, which was still very much informal, but worked in maintaining those relationships, organizing webinars, organizing trainings, making sure that our patient and community activists were invited to international events like the Union Conference. So making sure that our voices was always heard, whatever was happening in TB policy, TB advocacy, we were making sure that we were there, that we were contributing, that our voice was being heard.
In the early years, we very much enjoyed being a very informal, unregistered, unregulated organization. There'd been that earlier history of Stop TB Partnership Europe where we had failed because we'd been trying to be too organized. But gradually we realized that if we were to continue and if we were to receive grants from major donor agencies, we would have to be properly registered. And then came TB-REP, the global fund making available funds for an initiative initially pushed by WHO Europe and the Moldovan organization PAS, with the PAS as the principal recipient. And by the time that proposal was finalized, we had been drawn in because we'd been developing contacts, particularly with WHO Europe, and they drew us in, and we saw ourselves as being able to provide the civil society linkages for that particular program. And that was all about trying to encourage and assist countries in Eastern Europe and Central Asia, i.e. the ex-USSR countries, to move more rapidly away from the sanatorium model that they had been used to ambulatory care for TB, such as was by then the standard practice in Western Europe and across the rest of the world, Africa, Asia, Latin America.
So for TB-REP project, we were advancing the people-centered models of care. We were very much closely working with TB activists and civil society organizations in Eastern Europe and Central Asia, and also with the partners in Western Europe to operationalize what qualitative, people-centered TB care should look like amid the healthcare reforms which the Eastern Europe and Central Asian regions has been undertaking at the time. So we were advocating for inclusion of the components of psychosocial support and broadening perspectives of care at the outpatient settings, from biomedical to holistic comprehensive care, which would see a person with his or her their life circumstances and needs, which should be addressed in order to support the successful pathway to treatment.
And that made a big change for TBEC, because that meant we were now responsible for an actual program that had to be delivered. So we needed staff, and we needed those staff to have a base. And so we talked about where should we have a secretariat, and there were 3 or 4 places suggested. But eventually there was a bid from Alliance for Public Health Ukraine, and we thought, yeah, that sounds about right. That's good. It's a well-structured organization that's very competent. It's already present right in the middle of the area we're concerned with. It looks like a good place to be. And so TBEC became Ukraine base, but still we're doing work across the whole of the region. And so we began to really become the regional organization that we had thought about in the past. And also, apart from those workshops on advocacy, we also had one series of 4 workshops which were aimed at NTPs to explain to them what is civil society and how might they work with civil society.
I joined TB Europe Coalition in 2016. At that time, it has not yet been officially registered, but it was a growing multi-country network supported by the very active steering group. So at that time, I was technically hired by Alliance for Public Health as a TB advocacy manager for implementation of the regional TB REP project. It was the first regional tuberculosis project supported by the Global Fund, and Alliance for Public Health and TB Europe Coalition had this partnership arrangement for implementing part of the TB REP project.
With a lot of energy and the right people, we managed to grow, and eventually decided that we would register TB Europe Coalition as a foundation.
And so in 2016, we finally agreed that we would get registered. We started looking, we went through quite a process to decide which country we would register. And we eventually settled on the Netherlands. Partly because it was a member of the European Union, and we were concerned to be able to access European Union monies. And also we were told that it was a rather relatively easy process to get registered in the Netherlands, which it is, but it is not an easy process to continue to be registered in. We have had lots of hassles with the registration authorities in Netherlands. But still, that's where we are registered. And once to get registered, we also had to have a proper constitution, a proper structure. And so we organized, so we did through late 2016, early 2017, we did finally set up a very traditional sort of structure, that there is a board with a chair and co-chair and a couple of vice chairs, and then staff based, as I say, in both London and Kyiv. And that structure we maintain still today, and it seems to work reasonably well for us.
We have also been working very closely with TB Europe Coalition Steering Group, many of whom became the board member or oversight advisory committee members later on when the network has been officially registered. And we have been working on development of strong and inclusive procedures to run the organization, and kind of creating it administrative and operational capacity as a prerequisite for further successful operation after the registration. There were a lot of administrative work at the time to develop their procedures, administrative documents for TB Europe Coalition, all the issues regarding legislation, and we were collaborating with staff also of Results UK, Global Health Advocates, with TB Alert. So I think we were having like a real partnership across the region and across the Europe to make it happen. But I would also like to say that for TB Europe Coalition, for me, the major driving force is also TB advocates and TB survivors coming from Eastern Europe and Central Asia, whose experience of fighting the disease, whose enthusiasm was really like a driving force for organization to happen and to find its secretariat being located later on in Eastern Europe and Central Asia.
But it's important that we have since also registered a separate organization in Ukraine to be able to make bids to donors who are only interested in giving money to low and middle income countries. And I should also briefly mention that we did have, for also almost 6 years, we had a team working in London because Results United Kingdom had made a bid to the European Union for an organisation grant, and that was done on our behalf. And but it was came through results, and so the team was situated there. So quite a lot of work was done in those years by people based in London, as well as the TB rep focus people based in Ukraine.
After the registration, so that was the first time when we were working closely with Paul Sommerfeld as chair of the board to have the first round of hire for TB Europe Coalition Secretariat based in Kiev, like consolidated secretariat. And then I think it was 2018 when our first TB Europe Coalition dream team came true, and we were very excited that we now have the staff and the project and activities to support the network and development of network across Eastern Europe and Central Asia, as well as capacity building activities for civil society and TB advocacy activists across the region. So yeah, that's been very inspiring time.